All right, so in this discussion, we'll look at some of the disorders that affect the mouth and how to manage them. So we have a list of such disorders. So there are quite so many of them and vary in severity and causes as well. So we have dental caries, tooth decay, if you like. Then we have infection and inflammation of the gums, that is gingivitis. Then we have infection arising from some of the normal flora found in the oral cavity, that is oral thrush. Then we have stomatitis. Then we have canker sores, herpes simplex infection, and oral cancers. So let's look at them. So we start with dental caries. So this is tooth decay. Now I'll remind you of the structure of the tooth. So the tooth has an enamel, which is the outer covering. Needless to say, this is one of the hardest, if not the hardest, structure in the human body, the enamel. Then if you slice this tooth, you see that immediately underneath the enamel, you find the dentine. Then there's a small cavity inside the tooth there called the pulp cavity, which contains a loose connective tissue, that is blood vessels, nerves, and lymphatics. So the visible part of the tooth being the crown, then the embedded part of the tooth, which you can see here, is the root. Then that's the neck of the tooth. So you can see some plaque or plaque forming on the surface of the tooth. Of course, that is an indication that there's some residuals remaining in the mouth, mainly food stuff. Lack of proper oral hygiene leads to accumulation of plaque, and that plaque contains various microorganisms. Among them is bacteria, which thrives on carbohydrates, multiplies, and then causes damage to the enamel. So that is dental caries. As we can see, this individual here, the enamel is eaten up by bacteria growing in the oral cavity. So, of course, bacteria thrives on carbohydrate. Bacteria only multiplies or proliferates in an environment where it is favorable. So it has to be moist. There's presence of source of energy, which is carbohydrates. Now we know that bacteria breaks down carbohydrates incompletely, therefore leads to formation of acids, and those acids causes erosion to the enamel. So there's demineralization of the enamel. Okay, various minerals that make the enamel to harden are lost over time, leading to erosion of that protective covering of the tooth. What puts individuals at a higher risk of developing tooth decay? Number one is poor oral hygiene. We find that these individuals who rarely clean or brush their teeth with appropriate toothpaste. So such individuals at a higher risk of developing dental caries. Next is diet. So diet that is high in sugar content, starch, and so on, and other beverages, especially taken at night. And then there isn't so much meticulous, oral care. Usually we have a night meal, sometimes late, and usually some of the individuals don't take time to clean the mouth, and that predisposes one to having dental caries. Others have medical conditions such as diabetes, putting them at a higher risk of developing such conditions. Age. Of course, dental caries or tooth decay is commonly seen in adults, old adults, individuals in their late phases of life, okay, because of the constant wear and tear that occurs, especially after exposure to various microorganisms. This is also common in younger children, okay, because of their, you know, you know, children usually like sweet stuff, cakes, sweets, and so on. So that sugar provides a good environment for growth of microorganisms. All right. Signs and symptoms, mainly there will be tooth. First of all, it is staining of the teeth. You see that there's change in color. See, that's the beginning. So a plaque forms on the surface of the tooth. These are waste of, dirty matter accumulating on the surface of the tooth. Shows that this person doesn't clean their tooth effectively. Then followed by cavitations. So those cavitations expose some of the nerve endings found in the dentines and causes sensitive teeth, sensitive to cold beverages and hot beverages. So you find when person is chewing, they usually experience pain. Then the discoloration of the teeth is because of the accumulation of plaque on the surface of the teeth. Then there's bad breath, referred to as halitosis. So this is quite a common problem, especially in individuals of poor oral hygiene. Okay. So treatment mainly involves various modalities. So first of all, it is improved oral hygiene. Next, followed by dietary control. Okay. So oral hygiene mainly, at least on a minimum, brushing of teeth should be at least twice in a day, in the morning and before, sleeping. If manageable, even during the day, 3 times, that will be very effective. Now, the toothpaste used must contain appropriate chemicals that help to prevent and protect the teeth from decaying, such as fluoride, okay, and several other extracts. In an event that there is so much erosion, almost the whole tooth going up, then tooth extraction becomes the other alternative to prevent other teeth actually from getting the same problem. Prevention, regular brushing, and visitation to the dentist at least once a year for inspection, screening, and early diagnosis and treatment. Other conditions that we will find affecting the oral cavity are inflamed gums, again, similar predisposing factors like tooth, decay. So how do we manage, this problem? Or we can look at the signs and symptoms, is swollen gums. Okay, so we can see gum recession here because of accumulation of plaque. So gums become swollen and easily bruise and bleed because of the infection going there, causing inflammation. So when you see swollen gums, dark or red gums because of the dirty accumulating on the teeth, gums that easily bruise and bleed, then bad breath, referred to as halitosis, receding gums, I demonstrated that earlier on. So that is, receding gums, that swelling. There's more like separation. See, that space, that's where the gum should be, but it's occupied by the plaque, which is a fume of microorganisms and some food residues. Then tenderness, of course, there'll be pain, especially on chewing. So mainly this requires removal of the plaque and improved oral hygiene. Otherwise, this shouldn't be a serious, problem. Mouthwash and, of course, paying attention to diet. What are we having at night before we sleep? That, accelerates accumulation of plaque and growth of microorganism. So prevention strategies are similar to dental plaques. Otherwise, we look at oral thrush. Now, oral thrush, this is candidiasis. So Candida albicans is a normal flora of the digestive tract. It's also found in other places like the female reproductive canal, which is a vagina. So in those places, equally can cause thrush. So we have oral thrush and vaginal thrush. So this is exaggerated growth of fungus in the oral cavity. Of course, there are various predisposing factors to this problem. So you see whitish patches in the mucous membranes of the oral cavity. So that is a uvula, but you can see that spreading all the way to the gums, some on the lips, and so on. So when these lesions rupture, those swellings you are seeing, the whitish part, when they rupture, they leave open sores, okay, with a clear and reddish margin around that place. Quite difficult to treat, but this are usually seen in patients with weakened immune system. So that's one of the predisposing factors. It can be seen in patients on chemotherapy, patients who are having chronic conditions such as HIV and AIDS, diabetes, TB, and several other chronic conditions. Prolonged use of antibiotics. So antibiotics, of course, are used in treatment of bacterial infection, but with prolonged use, they also cause eradication of normal flora of the digestive system, and therefore allowing candida to take advantage and grow excessively, causing inflammation of the mucous membranes. Of course, poor hygiene, dry mouth, smoking, and individuals who have artificial, devices in the mouth, such as dentures, braces, and what have you. Of course, you see whitish patches. If they rupture, you see red ulcerations in the mouth. Then cracking on the mouth and lips, usually, of course, because of the pain accompanied with feeding, appetite is lost, and patient experiences difficult swallowing. So medication is with either topical antifungal or systemic antifungal medication. Okay, sometimes you find gentian violet is used on those ulcers, or nystatin applied direct on the open sores from oral thrush. So that tends to help the patient to recover. So you're just controlling the multiplication of the fungus to allow healing of the mucous membranes. Stomatitis, this is another problem affecting the oral cavity, which is inflammation of the mucous membranes by various causes. Okay. So you see painful sores, ulcers, blisters, and so on, making feeding very difficult. So we have a host of causes ranging from viral infection, mainly herpes simplex virus, bacterial infection commonly associated with syphilis. You see chancres, open sores, usually on the corners of the lips. Could be fungal infection, other irritants, food additives. Those can cause, inflammation around the oral cavities of the mouth. You see redness, bad breath, bleeding gums, swollen cervical lymph nodes, and sometimes, depending on the cause, elevated body temperature. So most of these oral problems, diagnosis is based on history taking. Okay, if there's been any exposure to individuals, similar conditions, sharing of formites, utensils, cups, spoons, and so on. Physical examination, you look at the nature of the sore that the patient is presenting with. Okay, then in rare cases, a swab is taken for microscopic examination to identify the causative urgent. Okay, but just by the presenting symptoms, you can tell whether it is oral thrush, a syphilitic chancre, or indeed herpes simplex infection. So we have canker sores, or otherwise known as aphthous ulcers. I usually have struggles pronouncing those words, so I beg your pardon. So these are ulcers that develop around the mouth, that is in the mucous membranes of the lips, gums, and the sides of the mouth. All right. So making feeding difficulties, especially in younger children. So you see it on the tongue, see it on the inner surface of the gums, on the lips, and on the sides of the tongue there. Okay. So risk factors mainly is physical trauma, biting oneself while feeding, harsh, when we're using toothbrush with very strong brittles, and that causes injury. Then food additives, acidic food that contain acids, for example, lemons, oranges, and highly spiced food. So you use that a lot. You see ulcers developing around and within the mouth, especially lemon because of high acidic content. Other predisposing factors, hormonal changes, nutritional deficiency, especially patients who have deficiency in vitamin B12 and vitamin C. Again, it could be a reaction to some food allergies. Okay, so we have painful sores around the mouth. Usually they are tender and tingling. Difficulties in talking and eating because of the pain that comes from there. Cervical lymph nodes usually are swollen, and depending on whether that is accompanied with infection, patient develop fever as well. All right, so most of these are self-limiting. Okay, within a week or two, usually the immune system is able to take care of such. Okay, and patient recovers, fully. So improve oral hygiene, and if available, you give some broad spectrum antibiotics. Okay. So herpes simplex virus, of course, herpes simplex infection, you see blisters with fluid inside, usually appearing as a single blister on the corner of the mouth. It could be on one side or both sides, but usually on one side. So usually begins just as a tingling sensation on that area where the virus found a port of entry. Then later on develops into blisters, usually within 24 to 48 hours. That blister keeps on growing, and then you see more around that area. Then the blister changes from reddish to yellowish. Then finally it ruptures. Okay, then you see it being replaced with a dark covering. That is herpes simplex virus, otherwise known as cold sores. So causes similar sores on the gums and inside the cheek of the mouth. It can also cause similar blisters on the reproductive parts, either male or female. So that becomes genital herpes. So it's transmitted in various, ways. So there are two types of herpes simplex virus, that is 1 and 2. Of course, 1 is responsible for cold sores, as you can see, ulcerations around the oral cavity. So different from stomatitis, because stomatitis, mainly the ulcer is open and so on. But herpes simplex usually is closed until day 3 or somewhere there, then ruptures and the crust develops on top of. So very hard, covering. Herpes simplex, virus 2 usually associated with genital warts and is sexually transmitted from one person to the other. So transmission mainly is through physical contact. So contact with saliva, of course, via kissing or, body fluids during sexual intercourse and sharing of mainly utensils, cups, spoons, and so on. But mainly is through kissing and sexual contact. The virus can also be transmitted from the mother to the unborn child during pregnancy and to the child during labor. All right, so we see that in our immunization schedule, we are what we call pentavalent. Among those vaccines in a single vaccine, among them is a vaccine for herpes, simplex infection. We call it DPT, hep. Okay, so clinical features, of course, you see itching on the port of entry. So begins as an itchy sensation, then a blister forms later on. You see blister filled with fluid, and patient experiences flu-like signs and symptoms, headache, body aches, fever, and then what remains now is just a blister around the mouth. So history taking, of course, you ask the patient if they have been exposed to any, if it's genital herpes, if they are then unprotected intercourse, or history of kissing. Physical examination, you look at the presentation of the blister itself. In rare cases, a swab, microscopy, and blood test can be done to identify causative agent. So there's no cure, but the individual remains infectious. So once exposed to the virus, person keeps on passing on to the next person. Really, there's no cure, so that becomes a carrier. Of course, practicing good hygiene, avoiding direct contact, especially using same cups, spoons, and so on, and protected sexual intercourse. Of course, it may lead to problems like meningitis, encephalitis. Otherwise, it is self-limiting. Most of the viral infections are self-limiting, but caution is that this person remains infectious for life. Now, oral cancer mainly associated with so many predisposing factors. All right. So tobacco use, this is seen in chain smokers, individuals who smoke, several cigars in a day and over a longer period of time. The heavy alcohol consumption, human papilloma virus infection, especially now with the advent of oral sex, this is becoming a huge problem. Then exposure to UV light, poor oral hygiene, and family history of cancer. It could be esophageal cancer or any other type of cancer, putting an individual at higher risk of other types of cancers. Okay, so you see ulcers around the mouth that don't heal, despite person being put on either antiviral or antibiotics. Okay, so hoarseness and soreness of pharynx. So you find that affects someone's speech and so on. So diagnosis requires biopsy mainly. Of course, we'll not forget history, physical examination, but you see this patient, sores in the mouth are not healing and maybe they keep on getting bigger and bigger. So a biopsy and then later on microscopic study to see the cells scraped from such a sore. Of course, you see that now cells are becoming, they are losing features of cells you expect to find in the oral cavity. Of course, we expect to find squamous cells there, but you see cells changing their features, what you call anaplasia, which is an indication of early stage of development of cancer. So treatment, of course, is either surgery, radiation, or chemotherapy, or a combination of two of these modalities, depending on the extent and type of cancer. Those that are benign, it's easier to excise them using surgery. But, malignant ones, you may need radiation and chemotherapy to eradicate those cancerous, cells. Of course, preventive strategies are addressed towards the causative or predisposing factors. So control of tobacco use, limitation in alcohol consumption, and good oral hygiene. Okay. So periodontitis now, this is inflammation and infection of the gums spreading to the ligaments. Now, I don't have a diagram here, but if I go back to the diagram of the tooth, yeah, we can use this one. So that's a crown. The root is in the gum. That's the neck. Now, in the root there, because that's where the tooth is attached to the socket. That is the mandible and the maxilla above. There are tiny ligaments that emanate from the dentine and anchors the tooth into the bone, either the mandible at the bottom there or maxilla above. We call those ligaments as periodontal ligaments. Okay, those are the ligaments that need to be chopped off when the tooth is about to be extracted. So it stabilizes and attaches or anchors the tooth to the socket, making that joint between the tooth and the bone to be movable, right? Slightly movable. So infection spreading to those ligaments is what you call periodontitis. I beg your pardon, periodontitis. Okay, risk factors, of course, smoking, genetics, misaligned tooth, hormonal changes, and various medical conditions. Symptoms mainly similar to what we have seen, before. So this is where I'll end with disorders of the mouth. Yeah. So next we'll look at disorders affecting the esophagus. Then we'll go to stomach and proceed down there.